Scar tissue work is really important for restoring not just the flexibility, but also the connectivity of your brain to your lower abdominal muscles for movement. So if we have restrictions across this low area of our abdomen in that C-section incision, it actually creates a block for the brain to be able to connect well with those muscles, and also for those muscles to be able to develop a consistent contraction for movement. So know that this work is really important for restoring that over time. C-section massage is a 3-step process. Number 1 is going to be an abdominal massage. Step 2 is going to be working around your C-section incision. And number 3 is going to be worked directly on top of it. For the purposes of this video, this piece of tape is going to be my C-section incision. I find that doing this work lying on your back is most comfortable and most effective because you want your abdominal wall to be in a fully relaxed state. So get comfy, prop your knees, either knock them together or you can have your legs supported up onto a bench or a chair if that's more comfortable for you. Other tools you want to have available. One is some lotion, because that's often a little bit more comfortable as we're working through the abdominal massage portion here. And then I also recommend either having some coconut oil or vitamin E oil for working more directly around the incision and directly on top of it. So step 1, doing that abdominal massage work. We want to start with the tips of our fingers and applying pressure, but in a more horizontal way rather than a pointy way down into our abdomen. So that horizontal pressure, think about 30-ish%, you're going to work in this circular pattern, working all the way through the upper portion of your abdominal wall, because there's often a lot of tension in this area after having a C-section incision, and this tension here is also creating a pull on the incision itself. So loosening this tissue here is really helpful for improving flexibility across the scar and also decreasing pain and discomfort. When we do this massage work here, it's also really beneficial for improving circulation and also helping to stimulate the bowels, because that's also a really common thing to have constipation develop when we are in the early weeks and sometimes early months postpartum following a C-section. So all of that is beneficial for those purposes. So you want to do that work for about 1 minute. And then we're going to move to step 2, which is the work around the scar. So around the scar, I like to describe it as kind of a 2-finger width neighborhood surrounding the incision itself. We want to work and improve the glide around that tissue first also to then be able to improve the flexibility across the scar itself. So still using the tips of your fingers, you're going to apply that about 30% of pressure still in that horizontal kind of pressure versus the really pointy downward pressure. And in that horizontal way, we're going to work side to side. So using the fingertips to glide in that way all the way around the incision itself. And I recommend setting a timer for about 1 minute and working in that way around the area. Then you're going to do the same thing, but you're going up and down. So this more vertical work, same thing, about that 30% amount of tension, and gliding around your scar itself. And then finally, circular. So we're working in that clockwise way, going all the way around, and then do another pass counterclockwise to get all of the different directions. Step 3 is going to be worked directly on the scar. Now there are kind of 2 subcategories within this. If you are earlier postpartum and this area is really difficult and uncomfortable for you to touch, then I want you to work on desensitization of the scar first. You're going to need either a soft cloth or something like a Q-tip or even a cotton ball. And you're first just working to help give a little bit of tactile exposure to that scar. So I'm not applying a lot of pressure here. I'm just getting my body to get used to having touch across this area again. So using something like a Q-tip and then eventually progressing to something like a soft cloth to again blot. And eventually to create some gentle passes. Okay. For some individuals, they're only going to be able to tolerate this very light touch in the very beginning, and using a cloth will be too much. If that's the case, just continue to progress in that light way, working towards the little strokes and things until that starts to improve, and then you can progress to the towel. And then if you are in a case where that desensitization is not a problem for you, then you can progress directly to the scar tissue work on the scar with your fingertips. So again, we want to go through all of those same directions that we did around the scar, but now applying it directly to the scar. So starting with about that 30% of pressure at the end of one side of your incision, and we're going to work in that horizontal way again, gliding side to side all the way across the scar. Then you're going to come back and go vertical all the way across the scar again. And then finally, working in that circular way, clockwise and counterclockwise. So each of these will take about a minute in length for that work. As you're going in this way, I want you to pay close attention to the areas that feel most sticky or most restricted. That's the area that needs more love and attention. So you want to really focus on those areas more often as you progress through your scar tissue work. We want to be thoughtful that we're not applying too much pressure and causing increased pain and discomfort across the scar. There may be a little bit of discomfort initially as we're getting tissues to glide, but I don't want it to be sharp or a sudden increase in pain. If you notice that, then go ahead and back off on your pressure. Over time, this should start to become easier to apply a little bit more pressure from that 30% to about 50%, and then eventually being able to apply full pressure with a full restoration of glide across your entire scar. For some individuals, this will be restored in a few weeks of time, and for some individuals, they'll need multiple months. So just be kind with yourself and know that consistency is what really is going to bring the biggest change to this area over time. Other things to note here, there can often be what we call a shelf, where when you're in vertical and standing up, sometimes the top portion above the scar kind of protrudes over where those adhesions are across the incision itself. Doing this scar tissue work helps to improve that. So know that if you have that and are concerned about that, this is a really helpful technique to also support that healing. Finally, if you're noticing that there is still a lot of stickiness in different areas, one other tool that we call is skin rolling. And this is really helpful after you've done all of what I just described to final pass with this skin rolling. So with this, you're literally going to kind of squeeze your tissues between your fingers and then push your thumbs towards your fingers to kind of roll the skin underneath. So again, we kind of pick it up and then we roll by pushing our fingers towards our index fingers. This really helps, again, to just add another layer of mobility and work to help improve that flexibility. So to recap, step 1, you're going to go through your abdominal massage at the top. Step 2, you're going to come and do your work around the scar. Step 3, you're going to do your work along the scar. That may be desensitization work first if you're at that stage, or if you're past that, you're going to do your scar tissue massage work directly across the scar. So I recommend going through this particular massage technique every other day, and in your early weeks postpartum, going through the 3 stages that I mentioned. As healing continues and as your tissues are starting to glide more, you can then start to discontinue the abdominal portion and the work around the scar as those tissues are now gliding well and that you don't notice any sensitivity while you do those techniques. And then just continue to focus on the scar most specifically until there is no more stickiness across that area. Finally, if you've been trying this technique for a few weeks consistently and have noticed no improvement in your flexibility or an improvement in your pain or discomfort, I recommend pausing and connecting one-on-one with a pelvic floor physical therapist so we can help figure out what additional tools you need to support your healing.